All right, ladies and gentlemen, we are here with Dr. Teri Stockwell, a veteran in the chiropractic industry. We are going to go over so many incredible things today. You've been a chiropractor for 32 years now.
I have.
And you've been at Life University for the past 14.
Correct.
She is a CBP instructor. I mean, if you don't know, there's only how many instructors? Maybe 10?
Yeah.
Like 10 in the whole world. So we have such an incredible guest today.
Thank
Your specialties have been not only helping your community, but helping mothers and children in pediatrics. Right?
Yep. My practice was pediatric focused and mamas and babies primarily. So lots of births and then, seeing families from, I had great grandparents, parents and children who, by the time I finished practice, were all part of my practice. So yeah,
that's amazing.
It's all families. It's a wonderful way to practice.
Yeah,
it's great.
What do you think was like? Obviously, in order to have that, first of all, you had to be an incredible. You had to create an incredible experience, one that was like inviting and for people to just want to bring the rest of their family in.
True. That's true. It really is about welcoming. You have to have a practice that can accommodate children who are running around without it being absolute chaos.
Yeah.
And it is just, if I also, I came from a very large extended family and spent my life around kids. So that was part of it. I was very comfortable around children. And I have had 4 children of my own who now I have 8 grandchildren.
Yeah.
And just kids.
Yeah.
It's always been about kids. So the whole environment is, it has to be welcoming and it has to be low stress. And so you don't want people in your world that disrupt that stress.
Right.
So you find energetic ways of kind of releasing the people that don't fit and bringing in the people who do fit. And it starts out with a few people who then refer like-mindeds, and you end up with a great big practice that never feels a day like you're at work. So
yeah.
It's great.
Well, I'm interested to hear more about your family. You said that you're part of an extended family. Where do you fall? Like, who were the kids that were around you?
Well, my dad had 10 brothers and sisters.
Oh, okay.
So, and we were the ones who hosted all of the major holidays. I had 32 cousins.
Wow.
I was in the older part of that spectrum.
Yeah.
So I watched a lot of them, supervised a lot of them.
Yeah.
And just, I just spent my life around a lot of kids. So I just had always been around kids, and it was just natural to do that. And then before I became a chiropractor, I worked with severely multiply handicapped children. So I was a teacher.
Yeah.
And I worked with severely multiply handicapped children. So I had experience there with kids. And, I think when you have those kinds of experiences, universe sends you those kinds of experiences.
Right.
And so that's really, I had just set my world up to be a pediatric chiropractor. There was no other way. There wasn't going to be anything else.
Totally.
It was about kids. So you just get started. And, I went through school, and I had 3 children before I started school, and then I had another when I was in school. And so, as I was learning, my kids were my practice.
Yeah.
who I practiced with on. And I just.
How old were they?
The oldest was, when I started, I want to say maybe 9. And the youngest when I started was 9 months old. And then I had another baby when I was into practice, another almost a little bit over a year into practice. So tiny to, Pretty big
yeah,
kid.
yeah. Well, that's amazing. Okay.
Yeah, it was good.
So, do you think that was there like a connection for you with like how did you get into chiropractic? What is your chiropractic story?
Man. Everybody has one of those. Right?
Yeah.
I was an orthopedic nightmare. I was an athlete. I was a gymnast. I skied, downhill skied. I was a swimmer, and gymnastics is terrible on spines.
Totally.
They say gymnastics is the only sport that can create a scoliosis.
Yeah.
And I have one.
Yeah.
And just lots of aches and pains, lots of, all along, some pretty good injuries all along. And then I remember not really, I think we had, my father had an osteopath, but we didn't see the osteopath, but we would go with him to appointments, and that always like fascinated me because he was an osteopath that did spinal adjustments.
Oh.
And so I'm supposed to say manipulation, but
That's okay.
So I was aware of that concept, but not of chiropractic, and that's how I became a chiropractor.
Amazing.
So, I know
So just with one adjustment,
it was
you were
literally
like, okay,
yeah, one adjustment,
this is it.
and then seeing other chiropractors as we moved around. The chiropractor that we saw in New York, we became good friends with. But I would ask questions, right? I'd go to the office and I'd say, okay, well, what about this? And how does that work? And how neurologically, what's happening? And all of those things. And he finally just looked at me and he said, well, why don't you go to chiro school?
Yeah.
Like,
you're asking too many questions.
You're going to get all this answered if you go to school. So then it was, maybe I should do that. And that's when it was too far away. And then it was just right. And so I did it. So
that's amazing.
Yeah. It's crazy how we get drawn into this, right? And people say chiropractic chooses you.
Yeah.
It's true.
It's true.
Certainly in my case.
Yeah.
Yeah.
So so now you're in chiropractic school, right? You have your kids. You've been a loyal wife. Following, I imagine your husband was moving to these places.
Yeah.
So now, how did it feel to be going into chiropractic school at that moment for you?
Well, it was like finally, right? And then that also created problems, and we ended up divorcing. And then, when it was time to open practice, I thought, you know what? I know where I'm going to go. I'm from Michigan. We had a cottage in northern Michigan. It's always where I wanted to be.
Yeah.
And I thought, okay, I'm going to raise these kids on a beach.
Nice.
So that's what we did. So moved to northern Michigan and opened my practice there.
Yeah.
And then practiced in Traverse City for
20 years.
Almost 20 years.
Yeah.
Just shy of 20 years before I came down here.
That's amazing.
Yeah.
So you just took the bull by the horns. You're like, all right, I'm doing it.
Yeah. This is what I'm doing. And back then, we could still get business loans, and I knew I wasn't going to work really well with, right? I knew what I wanted to do, and I knew how I wanted to do it.
Yeah.
And so I just, put together a business plan and got a business loan and opened a practice.
Amazing.
So, yeah, it was.
What was your idea? So coming from school, I mean, you was the school that you went to, what was the ideology of the school, and what did you take from the school, or did you learn outside of the school? Like, you had to know something in order to go, all right, I know what I'm doing.
Yeah, I don't know, I knew exactly what I was doing, but but I had a good sense of what I wanted to do. I knew I wanted to work with kids. I thought that was incredibly important. That you can, if you're working with kids, you can keep them from developing the conditions that we work so hard on adults to correct.
Right, it's okay.
And so I knew I wanted to work with kids, and the philosophy at the school, I went to Cleveland in Kansas City, and Carl Cleveland always stressed this is a nerve problem, right? It's a nerve problem.
Yeah.
So that was my orientation, that neurologically we could make some changes, and that's what I wanted to do.
Mm.
And I just knew I needed a space for kids and I needed room. And of course I can see adults. Adults are
That's
easy.
easy. Yeah.
Adults are the easy part.
Right.
And when you have a pediatric practice, if someone trusts you, if somebody says, here's my kid adjusting,
Yeah.
they trust you implicitly.
Sure.
And they will refer everyone they know, all their family, all their friends, that they're I think I put an ad in the paper when I first opened, and I put an ad in the paper each time I had a new associate come in.
Right.
And other than that, it was just word of mouth.
Referral.
It was just, this is what I do. And, and they all said, come on. So that's how
Amazing.
it's just how I functioned.
Yeah.
It's just how it worked. So it's wild. So, so I just opened and started doing and, and grew and grew and grew. And it was perfect.
Okay. So how did you learn about adjusting children? Was this something you took away from school, or you just applied these principles we learned of adjusting with adults to children, or what was that?
Just really applied them to children. The only people I had to practice on were my kids.
Mm.
So, I'm learning how to do a full spine adjustment. Okay, well, how's this going to work on a kid, right?
Yeah.
That's what I knew.
Right.
So that's what I did. And then I did do ICPA, certification. So I got that extended learning, and that was extremely helpful. And I don't know. It was just like I knew how to do it. It's what I was supposed to do.
Yeah.
So,
Yeah.
so how did I learn it? I'm not exactly sure.
Yeah.
But I, there was advanced study and getting all that sorted out. But all my life it was my kids who anything I learned that was new, it was like, okay, lay down on the table.
Yeah.
We're
Totally.
gonna sort this out. So,
Yeah. Exactly.
yeah. So that's, I don't know. I don't know anything else special. It's just you learn. I had a professor who used to say, why do you think they call it a practice?
Mm-hmm.
You're going to be, you're not leaving here knowing everything you need to know. Every single day, you're going to be practicing on those people who come in. And I can tell you, looking back on what I was doing when I first started to what I was doing when I left,
Mm-hmm.
it's almost embarrassing about like, what was I doing?
Yeah.
But they were so happy. They were right. I mean, you practice with everybody who comes in, and you get better and better, and you learn more, and you continue to grow, and it just evolves.
Yeah. Well, you mentioned this earlier about the importance of seeing children and preventing these incredible diseases and deformities that we can see in adults. But would you mind elaborating in the practice that you saw? Like, what were the common things that you saw with children?
With children?
Mm-hmm.
Well, I mean, beginning with birth, subluxations that come from birth. I mean, subluxations come from birth.
Right.
And if they're not resolved, they're going to lead to complications, right?
Yeah.
And if you think about, what are we teaching students here? I think we're teaching them that it's like maybe 10% of the population sees a chiropractor.
Right.
And of that 10%, how many of those do you think are children? And of those that are children, how many do you think are newborns?
Right.
And if you can adjust a newborn and eliminate those subluxations right then,
Mm-hmm.
And then if they have a spill, if they have a fall, and you can take that away right then, you're not battling all of the structural changes that happen as a result of that abnormal load on the spine, and all the supporting tissues. It's just a simple process.
Right.
So that's why it's important. And then I know you through CBP.
Right. And
when you look at that from that structural correction standpoint, we know based on CBP research, we know that if you have a normal spinal configuration, if you looked at a dot graph, if you have a normal spinal configuration and you look at any kind of disease, any, in pain, from pain to heart to whatever, the closer you are to that normal, the fewer your little dots of whatever are going to be along there.
Mm-hmm.
And the further you get away on either side of that, that's where all that stuff fills in, right?
Right.
And so if you're just keeping spine straight, you're preventing all this other stuff from happening, right? And we can take adults and correct their spine and also start moving those dots away. But if you're doing that with kids, you don't have to do all the rest of that. And it's not that I didn't see adults, because if you see kids, you see their parents, you see their grandparents, you see their aunts and uncles. Mm-hmm. A pediatric practice is like 1/3 of it is children, because you're also seeing their family members. Yeah. You have to do that from birth, or you're not going to stay ahead of it.
Yeah, guys, people don't know that you can adjust a baby out the womb.
Literally, I would go to births and I would adjust. As soon as midwife finished, sometimes before, because parents would say, let her adjust and then you can do the assessment. Immediately.
Yeah. This is so cool. Could you elaborate some of the experiences that you've had? You shared a story with me about being with a midwife during a birth, and there was another chiropractor who was, his wife was having a baby.
Yes. A colleague, a fellow chiropractor, they were having a child, and so having a home birth, and said, will you come and be at the birth and adjust baby as soon as baby comes? And I said, absolutely. I did that a lot. Yeah. So that was pretty normal for me. And so baby came, and midwife is starting to do her assessment, and the baby is cyanotic. There's like blue, the lips are blue, and they're getting bluer. And I'm looking at this baby, and I'm trying to be respectful that, I'm not the person delivering the baby. I'm not, or helping with the baby. Mm-hmm. That's her thing, and I have to be respectful and let her do her thing. But I was starting to get like antsy about this whole thing, and the doc is like looking at this and looking at me and looking at this, the mouth, and looking at me, and I find, I'm like, hurry up. And she, as soon as she said, okay, well, whatever, I said, do you mind if I just take a look at the baby? Hey, let me adjust this baby. Yeah. And I did, and instantly the blue went away. Everything was nice and clear and perfect. Yeah. And the midwife said, what did you do? And I said, I adjusted the baby. I removed subluxation that was keeping all this blood flow from getting where it needed to the brain. Yeah. And, we adjusted a cervical subluxation. And she said, can you teach me how to do that? And I said, no, but, Life University's around the corner, and you can go there. But I did say, what you might consider is making sure you have a chiropractor at each of your births. Yeah. Because it's clearly very helpful, and it's going to help the baby, and it's going to give, and if you refer your client to a chiropractor, right, then they're going to have, you're going to have overall better birth outcomes. So, yeah.
Well, here's the thing too. We as chiropractors can help the mothers throughout their pregnancy, right? They're going through, you would know this better than me, but they're going through these physiological changes that would have an effect on how their nervous system is functioning and their structure of their spine. They have weight in new places. So I don't know much about this, but how would a woman's body change throughout pregnancy, and why is it beneficial for her to see a chiropractor throughout that process?
Well, structurally, things change pretty radically, pretty fast. Hormonally, things change pretty radically, pretty fast. Hormonal changes are going to bring along with it a lot of inflammation. There's all kinds of things that go along with that. Structurally, as that gravitational load shifts, their posture shifts, and from a CBP perspective, we know what aberrant load does to that nervous system. And so, that combination of the weight changes, the inflammation, the hormonal changes, right? They get headaches, they get, the inflammation can cause Bell's palsy and, numbness, tingling in fingers, some carpal tunnel, all kinds of that stuff. And so, they need to see a chiropractor, because as we adjust them, we can help them navigate all of those changes. And then, postpartum, as we adjust them, we can help them get everything kind of unwind and back to where they started.
Right.
Which hopefully was in a good place if they were,
Sure.
if they were under regular chiropractic care.
Right.
But now, even if not, then they know now to keep getting adjusted. And a lot of people, after they have an initial birth with a chiro involved, then they want to see a chiro for the next ones and the next ones and the next ones. So.
Okay, so a couple questions now. How often would you see a pregnant mother during her pregnancy?
I mean, it always depends, but if that mom had been under my care all along, then initially I would probably just keep them on their regular schedule, right, on whatever they'd been coming in for them. And then as changes start to happen, maybe we ramp that up.
Right.
And then as we get closer, right, as baby gets bigger and can't move around as freely,
right,
babies can get into malpositions, right? There are ideal birth positions, and then sometimes they get stuck and they're not in that ideal position. So then there are things that we do in chiropractic, the Webster technique,
right,
very specifically, and then a Logan basic move that can be used along with that we can release that tension in that pelvis, remove any sacrum subluxations, and that just allows then that uterus to find its nice neutral spot. And if uterus is in a nice neutral spot, baby innately knows what position they need to be in to be born, and they find their way to that.
Yeah.
So seeing a chiropractor is really critical during pregnancy.
I always tell people that I've been adjusted since the womb because I was a breech baby. And my uncle Fred, he adjusted my mom using the Webster technique, and I flipped in her stomach right there on the table.
Yeah, right. And that's what I also teach, the special pops class here at Life. So I'm teaching a lot about this stuff too, and that's what I always tell them. Like a lot of times, you would watch it happen. As soon as you release that, sometimes the first time you did Webster, you'd watch that belly start gyrating, and mom would go, something's crazy happening.
There's an alien inside me.
What's going on?
It's alive.
So there's lots we can do, lots of benefit during pregnancy for moms and for babies.
Right.
So,
Would you say that if we compare a mother who is using a chiropractor throughout her pregnancy versus not, what would be some of these strong potential or like the benefits of going to the chiropractor versus not?
Well, the simplest things are, we have studies that show, I love, we always have studies that show, but we honestly do have studies that show that the improvements in birth outcome is like significant. It is shorter labor times. It is better outcomes, like fewer problems with birth, with the birth process itself.
Like maybe being a baby being stuck, and I'm not.
Well,
I'm
a baby being stuck. Fewer C-sections. because those malpositions often lead to C-sections.
Sure.
Webster
like the
technique
hips
has.
wouldn't be able to widen.
Well, sometimes, right?
Mm.
Sometimes that, right? Because all of that is governed by nerves that
Mhm.
follow that spine and those nerve roots. So yeah, just being adjusted in terms of where space in that pelvis, in terms of labor progressing, right? In terms of the dilation that has to happen for baby to come out, all of that. So it improves those outcomes in terms of faster birth, less pain medication
Yeah.
used by women who are under chiropractic care, which
Mhm.
implies less pain.
Yeah,
Where they,
yeah.
they're not asking, even just, faster birth and less pain is usually enough for a mom to go, yes,
All right,
sign
let's
me
do
up.
that. Yeah.
Right?
Yeah, totally. Yeah.
That's all it takes.
Yeah, that's pretty easy. Pretty easy, yes.
Yeah. So, it's an amazing way to practice. It really is.
Right.
And there is nothing that approaches being present at a birth and seeing that new life. Like,
Yeah.
it's insane. Every single time, I don't care how many births I went to, it's just like, it is the essence of God right then and there. And it's amazing. Absolutely amazing.
What does it feel like? Did you have natural births?
I did. I had 4 kids, and I had different births for each 4 kids.
Okay.
Because the first one, we had planned on a pregnancy center birth, right? Because it was first, and I was all geared for a home birth, but my spouse was not that comfortable with it yet, and so we had compromised on that, and it was a great birth center. But then he got transferred, and so he got transferred to another state.
Mm-hmm.
And we moved, and I was 7.5 months pregnant, I think.
Mm.
And so new state, and there were no OB, there were no midwives that would take me at that point that we could find. There wasn't a birthing center, and so you took what you could get. And I had an OB who was, it's almost. I always said this is counterintuitive, until I found another doc, kind of similar circumstance, who was amazing. But he was he was a medic. He was in the military, so he had this very military mindset, and birth was a process and everything, and it was horrible. It was just a horrible experience. The classic experience, and horrible. And so the next one, it was another state, different state, and there was a really great birthing center. And so again, compromised and said, okay, we'll do a birthing center again. I'm not really crazy about it. I really want a home birth, but okay. And then we did that, and the doctor didn't even make it in time to catch her. So, that was like, so the next one, I was like, you can go to the birthing center if you want to, but I'm going to be at home.
Mm-hmm.
So then for the last 2 were home births. So I had the traditional, awful, what most women go through experience, and then I had a birthing center experience, and then I had 2 wonderful home births. And there's I can speak to each type of process because I experienced it.
Yeah,
so,
that's fascinating, huh?
Yeah, wild.
Yeah, yeah, totally.
But yeah, I was not leaving. I was not going out of my house to have another baby.
Yeah.
So so and found a great midwife, and she actually would not take a client unless they were under regular chiropractic care.
Yeah, you told me this the other day, and I thought that was such a cool requirement of her.
Yeah.
I feel like we're in a time right now, there's a lot of controversy, not necessarily with pregnancy or children, but people are questioning what has happened with COVID and just more of the powers that be in this medical system. So I'm not trying to go down that road. All I'm saying is that there's this aspect today where people are more open to things that are outside of what typically they've always done.
Yeah.
So, as far as pregnancy and chiropractic goes, I think that this is an incredible time for students and chiropractors who are looking to make an impact. And the other day in this conversation, we were talking about home births, and you made a statement that was very definitive in saying that if you're not 1,000% committed to the home birth, then you don't want to do it.
Well, sure, because you can have if there's an element of fear about birth,
Mm-hmm.
that's going to show up in that whole process. So you have to have done your homework, and you have to have that sense of that home birth is safe.
Like peace with the
right?
situation.
Yep, and you ultimately are assuming if you have a birth in a hospital and something goes wrong, you can say it's the hospital's fault, it's that doctor's fault, I can sue that hospital.
Mm-hmm.
If you have a home birth,
Right.
you're assuming that risk, and
Right.
you're assuming whatever the outcome is on you, not on somebody else.
Right.
And you have to be okay with sometimes there are problems in birth, and sometimes birth goes wrong. And and just know that you go into it knowing, and this is what I would tell every single mom. You get into that, and you just have to say, my body was designed to do this.
Yeah.
Right? Anytime that fear comes in and you go, because at transition, women get into, first thing they'll say, and they're in transition, I can't do this anymore. I can't do this. I'm and then it's like, well, it's happening. you can't not do it.
Yeah.
So let's find a way that you can do this, right?
Yeah,
and you gotta make some connection that is going to allow that to happen, and that's
Yeah.
all you have to do is allow it to happen.
Do you think that there's like a common theme with some of the mothers who may have felt that? Is there like some sort of the same fear that is triggered by?
Well, transition is when all the pain, like if you see videos of women having babies and on TV, and it's always classically they're screaming in pain and agony.
Mm.
Transition is when that happens.
Mm.
And it is pain and it is agony.
Mm.
And if somebody has educated you about birth process, and you have your own self healing, your self talk, your things that'll calm you, you can get through that, because transition generally is about 20 minutes.
Mm.
And so if you understand that, not always,
Yeah.
but if you understand that, now you can talk your way through it, and you can visualize your way through it, and you know that it's temporary.
Mm-hmm.
Usually by the time you're in a state where you say, okay, I'm done, I want pain meds.
It's been a while.
You're done, you're almost done.
Yeah.
And they'll, in the hospital, they, in the olden days, would have given you those pain meds. I think increasingly, even in the hospital, they're saying, let's just give it a minute.
Yeah,
let's just give it a minute, right? We'll revisit this in a minute. But that's, you can't look at the big picture. You can't look at what at the end outcome. You're just living in every moment, and you're finding how do you manage to live in a moment through whatever it is you're going through.
Mm-hmm.
So that's the way through.
Yeah.
And right, it doesn't stop. You got to get through it.
Yeah.
You have to go through it. So let's sort out. And when you're working as a chiropractor, if I'm working with those moms, I knew all of the midwives in town.
Yeah.
And so I knew that I knew which ones were the best at and most helpful in working through them, and I would make some referrals over others. They were all good, but
Yeah.
I knew what they were saying, and we met. I met with with the midwife group oftentimes.
Yeah.
Did a whole bunch of classes with them on chiropractic and why that was important.
Mm-hmm.
And so I knew what they were saying, and I could help. I could support that, and they knew what I was doing, and they could support that.
Mm-hmm.
And we just had a good group of support
Community.
For women. Yeah.
Yeah, that's
great.
so cool.
Yeah, it was amazing.
Now, okay, so this is maybe an avant-garde question, but we talk about the women and the baby. Is there something that you correlate with men as well? Like, I don't know.
You mean in terms of that family practice and pregnancy and
Yeah.
that sort of thing?
Mm-hmm.
So men are pretty removed from this experience, right?
Mhm.
And so there were a number of things that I did to help men engage. One of those being there's a palpatory technique that you can use to see kind of in palpating mom's belly where the baby is.
Mhm.
It is outside our scope of practice in some states, not others. Palpation is in our scope of practice, so all I did was palpate. But I would show moms how to do that, and I would show dads how to do that, because dads get, they can feel a kick once baby's big enough to feel kicks, but until then, mom is feeling things and relating to that, and dads are kind of removed.
Mhm.
And so, we would do that, and they could feel that, and that was super helpful. Most of the midwives are good about getting dads involved, right? Because a lot of the classes they're doing together, a lot of the things that the midwives are doing to prepare mom for birth, dads come to. So yeah, I mean, I think just, and if a mom's having a home birth, dad's already pretty tuned into that, because they survive on fear.
Yeah.
And if they're afraid of that process, that mom's not going to have a home birth, right?
Right,
The dad's
right.
just going to say, like, absolutely not.
Mhm.
So you have a different kind of group of men who are involved in that process to begin with,
Right.
and it's kind of easy to bring them in and talk about what's going on, and it really is. It's about education. What's happening through all of this. And in the old days, right? They took moms, they wheeled moms into a room, they stuck dads in the lobby, and then all these random dads had women in there having babies, so they were opening up the bourbon and smoking cigars while mom was in there having a baby. And right, and how do you connect with that baby?
Yeah.
I mean, I think that
in the process
that whole process is connection, and it changes father-child relationship forever.
For sure.
Yeah.
Fascinating. And so what about, like, if there's a father or soon-to-be father who wants to be a part of this process, obviously showing up with his wife or with the mother, and having support, what would you say is something that the fathers did that really brought them and their spouse together throughout the birthing, throughout this whole process of pregnancy? Or
I mean, I think just being there, being apart from chiropractic, being at those midwife appointments, I think is very much part of that, because the obstetrical appointments they're informative on some level. The baby is right now the size of a walnut, now the baby's the size of a grapefruit, right, that sort of thing. But midwives are much more, they're going to let the dad hear the heartbeat. They're going to do all kinds of things that involve that dad in that process. And then always talking about what's the next part of this process. What does that look like? What should you expect to see? If you don't see this, what do we do about it? I think that kind of makes that whole process, but then birth itself is what, just solidifies that. It's just amazing.
Yeah.
So, yeah.
So cool.
It is cool.
Yeah.
It's a great way to start the world, to join the world, I think. And yeah, it's good.
I know that totally. And then, I've heard so many stories of chiropractors who treat children, from birth to their adulthood, and the children are just not, they don't have sickness, they don't have asthma, they don't have allergies to foods, they're just more resilient.
Yeah. Their bodies function the way they're supposed to, and innately we have immunity, and we know how to develop, and there's not, without that interference, they're just free to be.
Yeah. Now, embryology for us at Life University is now kind of spread through multiple classes. So I'm asking you this question because I haven't taken I don't think I've learned it yet, but are there particular nerves that also connect to the baby? I mean, I know that the baby develops like the notochord and it has its own nervous system, but is there an aspect of the mother's nerves that are connected to the baby?
Not directly, because
Mm-hmm.
the baby is its own entity,
Mm-hmm.
but those parts of the nerves that aren't connected, those parts of the nerve that, we connect,
Yeah.
and our nerves connect, right? Even
Right.
at a distance, all that's going on.
Right.
And, babies feel mom's stress,
Mm.
they feel mom's joy, they feel fear, they can sense all that. So,
Right.
so in that way, yeah, mom's nervous system, if they're stuck in fight or flight, that's what that baby's going to experience too.
And how would you say that would influence the development of the baby throughout the pregnancy?
Well, that's a whole nother that's a whole nother realm, because there are a lot of studies that talk about that. And so I don't know that we can really get into that, but it absolutely has an influence
For sure.
on that. Yeah,
And a significant one.
Hugely significant.
Right. So, I mean, just to make a blanket statement, like being under chiropractic care keeps you in a more parasympathetic state.
Well, a more balanced state, right? Because it's not about, we don't always want to be in a parasympathetic state either.
Right.
It's just that there should be this nice little balance that doesn't fluctuate much.
Mm-hmm.
And when people get into trouble, it's because they go way up here and they get stuck.
Right.
And then they come way down here and they get stuck.
Right.
And it's just about finding that nice, even back and forth
That's a good
balance.
Point.
Yeah.
Haven't thought of it like that before.
Yeah.
Okay, so then let's bring CBP into this, because you've had this practice. At what point did you start to learn about CBP?
So I knew nothing about CBP. I went to school in Kansas City. I knew nothing about CBP. I had never even heard about it. And when I was in school, I had a horrible back injury. I herniated 2 discs. I had no motor control to my leg. I had such severe pain. I really didn't think I was even going to be able to practice.
What did you do?
I saw every clinician at school said, I can fix you. And I'd go and they'd...
Yeah. Well, what happened
nothing.
to create the injury?
What did I do? Well, I had a scoliosis. I was a gymnast. I had lots of injuries from other things. So I probably had a predisposition to this.
Sure.
But what really precipitated it was a bad knee chest Gonstead adjustment. And it was horrific. It was horrific. I ended up with a spondy. And which, I'm not saying that caused the spondy.
Sure.
I just had a spondy,
right,
probably, that nobody knew about, and it was awful. So so I lived with that, and SOT, no more Gonstead. I didn't go back to Gonstead.
Yeah.
Every possible, my technique. I tried all those things, nothing. And I spent the last year at school dealing with that, and I really did not think I was going to be able to practice. And when I got to Traverse City to open my practice, I really was like, I got to figure out how I'm going to be able to do this.
Yeah.
And one of the things that I recommend all students do, I did this. I went to visit every chiropractor and say, hey, I'm new in town, and here's where I'm opening up, and this is how, whatever. And some of the docs were like, you're my competition. How dare you even step in my office?
Yeah.
And other docs were like, what can I do? And one doc who was very much, let me know what I can do to help you. I will send my CA over to help you set up your systems.
Mm-hmm.
I will, here are all my forms. You can make copies and do, right? And whatever. And by the way, I can fix you.
Right.
And I said, that's what they all said.
Yeah.
That's what they've all said.
Yeah.
And he said, give me 6 weeks.
Yeah.
And if you don't see progress, you don't have to keep doing that.
Yeah.
So I thought, well, what have I got to lose?
Yeah.
And he was a CBP doc.
Okay.
And so, so that was my first introduction to that. And
Wow, what a blessing to just start
right from the
beginning,
before I even opened my doors.
Yeah,
It was,
right.
so all of a sudden, oh my gosh, this makes sense. And it made I was not healed within 6 weeks.
Right.
It took a lot of time, a long time. But I knew at the end of 6 weeks, I was well enough to know that I was going to be able to practice.
For sure.
So
you were on the way.
I was on the way. So so I graduated in 94. I took my first CBP class in 95.
Mm-hmm.
And then I didn't go through and do all the certifications because he was helping me and I had the books. I got the books and I was doing all that stuff.
Don't tell Deed.
And watching videos. Oh, I told Deed. Deed knows.
That's funny.
But that's kind of how I started doing that.
Yeah.
And then looking at that was great with the tools that we had at the time, right? I could integrate that into my practice, and for all those adults, and for children, some children, right? We could do some traction with some kids because we didn't have all the fancy things we have now.
Yeah.
So it was a different way of practicing, and then traction for kids is different. And I'm not tractioning pregnant moms because the ligament laxity that comes with pregnancy because of the hormone changes.
Mm-hmm.
You don't traction pregnant moms. So it was really, these people could get true corrective care, and these people couldn't get full-on corrective care, but there was a lot of CBP that we could do with them.
Mm-hmm.
And kids, it was, we had some simple little things we could do for traction for kids. I could have moms do mirror image exercises with even infants because you just teach them how, like if they have issues with a persistent head tilt and you're adjusting them, you just have mom hold them into that head tilt, and then writing mechanism is gonna they're gonna work the muscles all the time. So you just work out ergonomically how you're going to get that baby to move in a different direction.
Yeah.
And you just incorporated all that. I could incorporate all that into it. I could incorporate the traction, and as we got dental rolls and that sort of stuff, it was super easy to traction kids. And always I just adjusted people in their mirror image.
Yeah.
Right. Whether they were signed up for corrective care or not, it's so much easier to adjust someone when they're in their mirror image because they're already at that end range, ready to go into that paraphysiological space, and it doesn't take much to move them. And so I would incorporate it that way. And then there are certain things. I mean, when we do a posture check on a baby,
mm-hmm.
we hold them upside down.
By their
little feet.
Yeah.
And they will assume what their postural deviations are, and then we can write down, okay, and now this is the mirror image, and I can put them in that and use instrument to adjust them in their mirror image. Other techniques where we can just kind of unwind in mirror image. So using that mirror image concept with infants even makes what we do with infants that much more effective and impactful.
Yeah.
So it was just saying, okay, well, here's CBP, and how do I take that and how do I make that happen in an infant, a 3-year-old, a 10-year-old, all the way through. So it seemed just simple concept to me. I mean, CBP is such a simple concept.
Yeah, I mean, you can go pretty deep with it, but I mean, at its foundations, it's very just like, hey, if you're right, then go left.
Yeah. And it gets complicated. It gets complicated, especially for adults, because now their ligaments have all changed and they have bony changes related to the aberrant load from the aberrant postures, and kids don't have that.
Yeah, they're easier.
Yeah.
I mean, I was with Dr. Fogel for a while, and
mm-hmm.
We would see children with anatomically short legs, and you put a heel lift in there, and after a few months you'd x-ray them again and they got perfectly even legs now. I mean, I would dare to say that doing these things prevents incredible disease.
Oh, absolutely.
Scoliosis, I mean, so common in females, young girls, to be able to develop that, especially like you said, doing gymnastics, jumping around.
Yeah.
You know, so if there's a way to get your children to chiropractors, like just start.
It's really important.
Yeah.
It's
Totally.
very important.
I know, and chiropractors, hey, you know, this is why I love my Uncle Fred. You know, he teaches some of these one-liners. You think about, well, if the mother has scoliosis and children are so incredible at mirroring the posture of their parents,
Maybe.
you know, like they're learning how to walk from somebody who has a gangster lean, you know?
Yeah, true. Yeah, that's true.
So, you know, the children tend to have similar postures as parents.
Yeah.
And this is the whole thing where, you know, some of the doctors who are not seeing children, if you just think of the patients that you have that have these postural distortions and you know that they have children, like you got to bring the children in.
Yeah.
They've had those distortions, but most of the time you're going to find that in their children. So
oftentimes that's true.
Yeah.
And when I first started in practice, we were still having to kind of had to beg or cajole parents into letting you see their kids. By the time I closed that practice and came down here, I continued to see pregnant moms and babies when I was here for a good long while. But by the time I left that practice, it was the babies and the children who were the first patients in.
Yeah.
Parents would come in and say, can't afford to get undercare myself, but I know you need to see my baby.
So cool.
And that was how it started. And so it went from, please, maybe can we see your kid?
Child. Yeah.
Can I talk to you about why
So
it's
like,
important?
I know I'm supposed to do this, but I can't afford it right now.
Yeah.
Please help my baby.
Yeah. Do something with my baby.
See? That's why it's revolutionary.
Yeah.
You
know, it is. And it's, you know, we talk at school and in our chiropractic philosophy about chiropractic miracles. And when you're working with kids, it's a miracle every day, right?
Yeah.
There are things that I saw in practice and would share, and people would say, you need to write that up.
Yeah.
And I finally said, I mean, if I had to write all of these things up, that's all I would be doing, because there is something like this happening in my office every day.
Yeah.
It's just, it's glorious.
Yeah.
Really is.
Well, we need to create a practice where we hire somebody specifically to help write it up.
That's right.
We just need to create a new job for a person to just be the scribe.
Absolutely.
Yeah.
It's crazy.
Yes. Well, I know that you said that you had an hour. We are at an hour, so I will be respectful of your time.
Thank you
but
very much.
Maybe we can have a part 2.
Sure. Yeah, we can look at doing that.
Okay, cool.
That'd be great.
Well,
Awesome.
thank you so much
Thank
for
you.
having
Thanks. It's been fun.
Here. Yeah, totally.
Great.
All right, guys, stay tuned for the next one. The person who just got on here, you missed out. Rewind it back to the beginning. You missed the greatest podcast. Okay, love you guys.